Welcome to the AffloVest patient training video brought to you by Tactile Medical. In this video, you'll learn how to confidently set up a patient on AffloVest and how to educate them for successful, consistent daily use. Accurate sizing ensures the oscillating motors in the AffloVest are properly positioned for optimal therapy on all 5 lobes of the lungs. Using a soft measuring tape, measure under the patient's arms across the largest part of the chest. Refer to the sizing chart to confirm the appropriate size. A 1-inch overlap and a 1 to 5-inch gap between front seams is acceptable. Before initial use, it is recommended to inspect the AffloVest to ensure the product, wiring, battery, accessories, and the controller are in proper condition. If any damage is detected, do not use or charge the device, and contact Tactile Medical for assistance. Before visiting the patient, gather all necessary components. The AffloVest should come with the Go Anywhere travel carrying case, a fully charged battery, the power supply, a quick start guide, and a patient training guide. In addition, we recommend you bring an adherence form and business card. Let the patient know that you'll follow up to see how their treatment is going and answer any questions. Before the patient visit, ensure the battery is fully charged. The battery is pre-installed in its pouch. To check the battery, look at the battery icon on the controller or look at the fuel gauge. The green LEDs will light up when charged. To charge, plug the power supply into the wall, then connect it to the charging port on the battery. The LEDs will blink during charging and turn solid when fully charged. Full charging may take up to 3 hours. Before visiting the patient, make sure the AffloVest is set to the correct treatment settings. By default, the AffloVest runs the Go program, a factory preset designed for most patients. This includes 3 treatment modes: percussion, vibration, and drainage. Medium intensity, 10 minutes per mode. If the patient's prescription differs from the Go program, you'll need to adjust the program settings. If a patient does not have specific device settings listed in their prescription, Go program settings can be adjusted at any time to accommodate the patient's comfort and personal preferences. To begin, turn on the controller. The AffloVest will power on automatically within 5 seconds. Next, navigate to the Program Settings menu. Using the arrow buttons, press the Play/Pause button to open the menu. From here, you can use the arrows and Play/Pause button to customize the treatment mode: percussion, vibration, or drainage. The intensity: low, medium, or high. And the duration: between 5 and 15 minutes per mode. Once you've made your selections, press Save. These settings will now run automatically the next time the patient presses the Go button. Once at the patient's home, begin by explaining the importance of airway clearance therapy. Let them know that their diagnosis can lead to mucus buildup, which increases their risk for lung infections. AffloVest helps keep airways clear, even when they feel well. Encourage daily use, just like brushing their teeth, as part of their regular lung hygiene routine. Refer to the patient training guide to support you in educating the patient. Show the patient what's included in the Go Anywhere travel carrying case. This includes the AffloVest, rechargeable lithium-ion battery, the power supply, and the welcome packet, a folder that contains the quick start guide and patient training guide. Please note that the user manual is available anytime on AffloVest.com. or by scanning the QR code on your Quick Start Guide. Let's review the battery and how to charge it. The best practice is to charge the battery every night after use, just like a cell phone. To check the charge, turn on the AffloVest and look at the battery icon at the top right corner of the controller, or by looking at the LEDs on the battery itself. To charge, plug the power supply into a wall outlet, then into the battery port. The battery does not need to be removed to charge. The LEDs will blink while charging and turn solid when fully charged. It takes approximately 3 hours if the battery has no charge. The battery indicator on the controller will blink when the battery is getting low and has approximately 30 minutes of use remaining. If the battery appears unresponsive, perform a reset. First, confirm that the battery is fully charged by checking the battery icon on the controller or the LEDs on the battery. Then, disconnect it, wait 60 seconds, and reconnect. You'll hear 2 beeps when it's plugged back in. Press and hold the power button for 3 to 5 seconds until the screen turns on. Help the patient try on the AffloVest. First, loosen the straps to the maximum size before putting it on and fitting the vest. Buckle the bottom buckle first, followed by the top buckle. Using the front adjustment straps and side straps, adjust the AffloVest to ensure a snug fit. The vest should be secure but not restrict deep breathing. Adjust the shoulder straps, if necessary, to position the motors correctly, just below the patient's collarbone. The bottom of the vest should align with the rib cage. The zippers on the bottom are for factory service only and should not be opened. Opening these zippers will void the warranty. To power on the AffloVest, press and hold the on-off button on the controller for 3 to 5 seconds. After a brief startup period, the main menu will appear. The vest is set to the default settings, unless the patient's prescription specifies different settings. To begin therapy, press Go or press and hold the Play/Pause button. Use the arrow buttons to navigate through the menus. To access a menu, press the Play/Pause button. The AffloVest controller includes Main Menu. It shows all individual treatment settings and all active treatment data. Program Settings menu allows you to customize pre-programmed treatment settings. Usage menu. Use this menu to view your patient's history of use. Digital Connectivity menu. Connect to Wi-Fi and Bluetooth to sync treatment data using this menu. The AffloVest includes 3 therapy modes: percussion, vibration, and drainage. Here's how each mode works. In percussion mode, all motors operate in a pulsed fashion. In vibration mode, all motors operate continuously. And in drainage mode, motors operate in a pre-programmed sequential fashion. The intensity can be adjusted, low, medium, or high, based on the patient's comfort. Pressing the Go button automatically starts with Go mode, and the system will perform the default treatment, 10 minutes each of percussion, vibration, and drainage at medium intensity. During the 10-second pauses, encourage the patient to cough to help clear mucus. Most patients use the default sequence. You can adjust settings during a Go treatment by pressing the Mode or Intensity button on the controller. If a patient does not want to perform the Go sequence, they can perform an individual treatment with custom settings that will only apply to that treatment. All settings are the same as Go treatment settings, but in an individual treatment, the time can be adjusted from 5 to 45 minutes. To customize individual treatment settings, navigate to the Vest Mode, Intensity, or Time icons on the main menu and press the Play/Pause button to toggle through setting options. To begin an individual treatment, press and hold the Play/Pause button. AffloVest can sync treatment and vest usage data through Wi-Fi and Bluetooth. Using the AffloVest app, patients can view their usage information and discuss it with their provider. It is recommended to connect via Wi-Fi so that your patient's data will sync automatically. If the vest is paired only through Bluetooth, it must be powered on and the app open on your device for vest data to sync. To pair the AffloVest to Wi-Fi manually, independent of connecting with the app, follow these steps. Using the arrow buttons on the controller, navigate to the connectivity icon and click the Play/Pause button to select it. Select the Wi-Fi icon. Turn Wi-Fi on and select Connect to New Networks. Select Connect manually. Select the preferred available network. Using the on-screen keyboard and keypad, enter the Wi-Fi password and click the green check mark. You will see a screen that says, "Success! You have connected to the Wi-Fi network." To connect to Bluetooth or Wi-Fi using the AffloVest app, have the patient download the AffloVest app from the Apple iOS Store or Google Play Store on their smartphone or tablet. Register the account before pairing the patient's smartphone or tablet to the vest by filling out the patient's name, email address, and password. Verify the account via email and then log in with the new credentials. The app will guide the patient through setup instructions. To pair and connect the app to the AffloVest, the patient will need to enable the Bluetooth feature on the AffloVest controller while on the connectivity screen and turn on the Bluetooth on their phone. The app will prompt the patient to search for the AffloVest device. After the app finds the AffloVest's Bluetooth signal, the controller will display a 6-digit PIN. Verify that the PIN on the controller matches the PIN in the app when prompted. The Bluetooth pairing has now been made. If Wi-Fi hasn't been set up through the controller, the patient should continue to follow the steps to authenticate Wi-Fi via the app. Select Enable Wi-Fi Syncing. Select the preferred available network. Enter the Wi-Fi password and click Connect. The controller will display an 8-digit PIN. Verify that the PIN on the controller matches the PIN in the app when prompted. The AffloVest is now connected to Wi-Fi and will sync data automatically. Proper cleaning helps maintain performance and is easy to do. Instruct the patient to clean the AffloVest at least every 30 days, or when visibly soiled, using a broad-spectrum disinfecting wipe or spray rated to kill at least 99.9% of bacteria and viruses. See the user manual for more detailed instructions. Do not submerge, machine wash, or use bleach. First, ensure that the AffloVest is unplugged from all power sources. Remove the battery and controller from their pouches. Unbuckle the front buckles and shoulder buckles and lay the AffloVest flat so the inside is exposed. Wipe the outer edges, starting in the collar area, tracing the outer edges all the way around the AffloVest, and repeat. Wipe fabric thoroughly, pressing into creased areas, and repeat. Turn the AffloVest over and lay it flat. Starting at the top, wipe the exposed fabric thoroughly, pressing into creased areas. Wipe all surfaces and buckles. Wipe inside and outside of buckle and buckle connector. Wipe inside of the battery pouch, including the plug protruding from the vest. Wipe the inside and outside of the controller pouch. Wipe the battery and controller thoroughly, including the cables. Wipe the carrying case thoroughly, inside and outside. AffloVest is designed to go where your patients go. The patient should use the Go Anywhere travel carrying case when traveling. If flying, they may check the vest in their luggage or carry it on. Instruct the patient to be sure to remove the battery and pack it in their carry-on, as lithium-ion batteries may not be checked in luggage. For international travel, use a plug adapter with the included universal power supply. To complete the setup, have the patient do their first treatment. The patient will put on the AffloVest and follow the treatment steps just demonstrated. Remember that the vest should be secure, but not restrict deep breathing. Have the patient adjust the shoulder and side straps, if necessary, to position the motors correctly, just below the collarbone. The bottom of the vest should align with their rib cage. Before leaving, sign the training guide with the patient and review the adherence form. Remind the patient, use your AffloVest daily, even when you're feeling well. It's an important part of keeping your lungs clear.